Bill Esteb is a chiropractic advocate, and Bill, we want to ask you, what do you think is a major obstacle that has to be overcome for people to embrace the chiropractic approach to healthcare?
Well, there's a couple of things. One in particular, I think, that we face, especially in the United States, is that we've become accustomed to this notion that if our insurance doesn't pay for it, then it's, we shouldn't have it or we can't afford it. And I think that chiropractors were seen as the primary care doctor, in the 50s and the 40s. I mean, for most of the history of chiropractic. And it wasn't until insurance started to cover chiropractic that we kind of fell for this trap. So I think probably the thing that it was kind of the best of times, it was the worst of times. It was the best of times because a lot of people were introduced to chiropractic because it was covered by their health insurance, and a lot of people now are feeling like that they can't avail themselves, particularly of a chiropractic lifestyle, because chiropractic isn't covered by their policy. So I think probably the infection of insurance is probably one of the biggest barriers right now.
So in other words, people need to empower themselves with making their own decisions about their health care.
Well, it's really about self-responsibility. How I treat my temple and how you treat your temple and, the audience treats their temple is a right that we are given by our Creator to take care of this or abuse it and let litter, in the hallway or whatever. And so it's really about personal responsibility. So I don't think we have a healthcare crisis as much as we have a responsibility crisis. So, you have to decide whether or not you are valuable enough to care for your temple and to pay for, its upkeep and maintenance and optimization, or whether or not you're willing to turn over that responsibility to a third party who has, frankly, a profit motive in mind here. If they can charge the policy holder as high a fee as possible and reimburse doctors as little as possible, they make a lot of money, and they are.
And ultimately, that is their goal, is shareholder profits, isn't it?
Well, it is, and let's not cast blame here. By law, they have to be as profitable as possible. That's what public companies have to do. So they're only doing what they are legally mandated to do, is to make a profit. Unfortunately, many people's health, they become pawns in this big scheme, and that's the tragedy.
So chiropractic actually helps improve one's quality of life and health without drugs and surgery, and it's really taking charge of your overall well-being.
Well, it is, and it's about, you can use chiropractic as a medical intervention in terms of symptom treating. And that's, in fact, how many people become familiar with chiropractic, as they have an ache or a pain, typically neck, back, whatever, spine-related. And they seek out chiropractic care because they think chiropractic is about the spine and the back and the neck. And on one level it is. But there's other ways of using chiropractic as well. And I've never really had back pain or neck pain or headaches and some of the other stuff that many people have had. But I would say that it is enhanced. And, of course, we don't have a parallel universe. Microsoft's working on that, I think, but we don't have a parallel universe yet. And until we do, it's hard to know for sure, whether chiropractic will increase my longevity, but it certainly has improved my quality of life.
Well, we know statistically, if we want to crunch numbers, doctors whose patients come in 12 to 17 times a year, see their medical doctors 43% less, have 20% less annual medical expenses. So we have some data out there. We know visits 3 times a week, once every 3 weeks, improves functional indexes, which is the ability for you to do more stuff. However, if you don't get sick, if you don't have problems, you don't know they weren't there because you were taking care of yourself.
Well, it's a lot like our immune system. Right this very second, my immune system, your immune system, is fighting a gallant battle against germs just because we're inhaling them all the time and whatever. And we never hear hip hip hooray, we beat another germ. It's just busily doing its job until it doesn't. And so we start thinking that it's the germ that's the problem, but it's our ability to adapt or withstand or to accommodate that. And My belief is that chiropractic, because it deals with the nervous system, is a way of making sure that your body is at full strength to do whatever it needs to do.
Well, Bill Esteb, thank you very much. You're a stalwart of chiropractic, a great advocate for the last 28 years or so, it sounds like. I do appreciate it, and hopefully our viewers will realize to take charge of their health and not just think about what the little plastic card from the insurance company says.
That's right. Thanks.